respiration. Rapid, slow, labored, shallow, irregular, okay? So as technologists, when taking vitals, you want to not only record the number of breaths, remember 15 to 20 is regular for adults, right? 15 to 20 breaths per minute, okay? But we're also going to use a descriptor, shallow, labored, irregular, okay? Any questions? Okie dokie. Some terminology that I want you to be familiar with respiration. Well, first let's talk about chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease. There are two different kinds. Two major kinds, I should say. The first one here, as we listed, is emphysema. Emphysema is a chronic disease. What happens here is that, you guys know what the alveoli are? The air sacs in your lungs? The little air sacs in your lungs? Okay. What happens here is they stay inflated. Your lung and the alveoli should be elastic. They should expand, okay, and bounce back. Expand and bounce back. With emphysema, they stay expanded. So they're in a constant state of expansion, which means that air is trapped into your lungs. So patients with emphysema, individuals with emphysema have a hard time getting air out. Okay? It's a chronic disease. Who are known for having emphysema?
Smokers.
Smokers. Air gets trapped in. It cannot go out. And then the opposite is asthma. Asthma. You have bronchial spasm. Your windpipe is constricted. Your lungs are constricted. Okay? So in this case, now they have problems getting air in. Okay? Those who are asthmatic, they take an inhaler to relax the windpipe and the lungs. So that way they can expand and it can be better inflated. Okay? So that's the opposite. We already know what cyanosis is, right? We all know cyanosis. Dyspnea, difficulty breathing. Tachypnea, rapid breathing. Okay? Rapid breathing of 40 or more respirations per minute. This is due to exercise, excitement, possible pain and fever, lung disease, heart disease, hemorrhage, nephritis, drugs, medications, and also age can cause tachypnea. Okay, so rapid breathing. All right, and then there is such a thing as hyperventilation. It's like tachypnea, because in tachypnea you can have fast breathing, but it is efficient. You're getting rid of as much CO2 as you are breathing in O2 or oxygen. There's an even exchange. Whereas in hyperventilation, you can have tachypnea, but the gas exchange isn't efficient. There isn't an even ratio. So you're sucking in more CO2 than you are oxygen itself. Hyperventilation. Man, it's getting hot in here, right? All right. Any questions here? It's starting to get moist in the armpits. Sorry. Okay, some more respiration terminology. The first one here is stertorous breathing. It's just another word for snoring. It's a lot simpler to say, right? Honey, turn over. You're stertorous breathing in my face. Snoring. Okay, Shane Stokes. This is an event. It's an event. What you will see here is rapid breathing for about 30 seconds. There is going to be a pause for about 10 to 30 seconds, and then rapid breathing again for approximately 30 seconds. So the cycle kind of goes over and over and over again. Okay? Movies. I love watching movies, and I like to be critical when they're trying to depict somebody that's, you're trying to apply medical stuff to a movie. Here's the one, for example. When someone's dying in their arms, I love you. Right? And that's what happens. In real life, this is what happens. Okay? You're holding them in your arms. They're doing this. And then they stop breathing for a while. And it starts again. And then their eyes roll back. And they die. I say that a lot, huh? You can die. You die. So that's what Shane Stokes is. Okay, this is real life. Okay, so there's rapid breathing, long pause, rapid breathing, long pause, rapid breathing. So what's happening here is they're trying to take in their last breath. Okay, there are some interesting videos on Shane Stokes on YouTube. Okay, I suggest, it's just my advice, you should take a look at it to get an idea of what this is. Okay, croup. Croup is obstructed by secretions. It's usually caused by a viral infection. So when somebody has a croup, it just sounds like real watery. It sounds like you're drowning in your own sputum. Okay, that's croup. When you cough, it sounds wet. That's croup. Versus stridor. Stridor is caused by an obstruction. So when there is inspiration, okay, there's going to be a whistling sound as you're breathing in. But this is caused by some type of obstruction. Okay, Pleurotic edema or even asthma can cause that. Any questions here? All right. Blood pressure. Blood pressure, any questions on respiration? Okay, so blood pressure is the amount of pressure that is exerted on the arteries. The amount of pressure that is exerted on the arteries. This is determined by flow times resistance. As we said before, blood pressure is a good indicator of shock, right? When you're in shock, what happens to blood pressure?
It drops.
It's going to go down. The instrument that they use to measure blood pressure is this.
Sphygmomanometer.
Sphygmomanometer. Sphygmomanometer. Okay. It's an instrument used to measure blood pressure. Blood pressure is written as a ratio. It's going to be systolic over diastolic. Systolic over diastolic. Systolic being heart contraction, diastolic being heart relaxation. Okay? Your systolic is going to be a lot higher than diastolic because it is squeezing the blood out of your left ventricle. Okay, so your systolic is going to be higher. Factors that will determine blood pressure includes age, gender, higher in males, your health status, your physical development, whether you're sitting, lying down, or standing up can also change your blood pressure. The time of day, emotions, activities. Also it increases after a large intake of food. Okay. Normal rates is 110 to 140 over 60 to 80. Again, systolic over diastolic. These are for adults. Okay. This is measured in millimeters per mercury. Millimeters per mercury. Adolescents is going to be a little bit lower, whereas in children it's going to be slightly higher. All right, monitoring. Average of 3 readings except in an emergency. Okay. When we're doing vital signs, how often do we do it?
Every 5 minutes.
Every 5 minutes. Every 5 minutes, right? This is saying here an average of 3 readings. Now, during an emergency, on average, we are doing taking vitals every 5 minutes, but also in emergency, sometimes we're doing it every 2 to 3 minutes. Okay, 2 to 3 minutes. And then we have the different types of manometers. You guys, don't worry about that. Cross it out. Don't worry about it. You know why? Because in a hospital, you know what we call the sphygmomanometer? We call it the blood pressure cuff. Where's the blood pressure cuff? Everybody knows what that means. Okay. Blood pressure terminology, we know what hypotension is, right? Low blood pressure, if the systolic blood pressure is less than 90 millimeters per Hg, that's hypotension. And hypertension, the systolic is greater than 140, and the diastolic is greater than 90. That's hypertension. All right, talk about lab values. We're done with the 4 cardinal signs, right? Everybody got that? No questions? As technologists, you are also responsible for understanding lab values. You will be doing many procedures that requires iodine contrast media. Okay? Before we do that, before we administer contrast, we need to evaluate their labs, their lab data. One of those things that we're going to evaluate is BUN, which stands for blood, urea, nitrogen. Blood, urea, nitrogen is amount of urea and nitrogen in your blood. Urea and nitrogen is a byproduct of metabolism. There are waste material, it is waste material in your blood. These are one of the things that your kidneys filter out. Okay? So, when we do our lab values, if they are elevated, okay, that means your kidneys aren't removing these waste products effectively. That's a good sign that you're having problems with your kidneys. Okay? So usually done, and we're going to talk about creatinine on the next slide, is used to evaluate kidney function in patients with failure or who are on dialysis. Remember, if you have an elevated BUN, that is an indication that your kidneys aren't functioning properly. Should that be an issue for us?
Oh yeah.
Right? Contrast is what? It's thick and viscous, very thick and viscous. So 2 things can happen here. Because it's thick and viscous, your kidneys are going to work harder to filter the blood. Are you guys with me so far? Because it's thicker and more viscous, your kidneys are going to work harder. So if they are having renal dysfunctions, we can put our patient into renal failure. Now here's the other problem. The longer, if your kidney is not filtering out the iodine, and it's persisting in your system a little bit longer, is that going to increase the chances of an anaphylactic reaction? Can that be damaging to your body? Okay, so those are the 2 things that can happen. You can go into kidney failure, and now you have no way to get rid of that iodine. Okay? So with BUN, it's going to be slightly higher in men. Slightly higher in men. Why? Because it says here, BUN levels increase with age, but let's talk about the amount of protein in our diet. As men, we love to eat meat. Okay? Women love to eat meat too, okay? But not as much as men do. We love meat. Even in salad, it's got to have meat, right? So our BUN is going to be slightly higher. Okay? Now, if you have a low BUN, that means that you have severe liver disease or malnutrition. Well, that makes sense, right? Malnutrition. Okay? Because that means if you don't have enough waste products in there, it means you're probably not eating properly. They correlate with what you eat. Okay. Any questions here? Creatinine, also known as creatinine clearance. These are your normal levels. Again, with men, they're going to be slightly higher. Creatinine, again, is a byproduct of metabolism. It's a byproduct of metabolism. So this is used to determine whether your kidneys are functioning normally. Normal is low. Creatinine is a waste product in blood and urine from metabolism. Okay. Increased levels of in blood levels. Okay, so If your creatinine levels are high, again, they should not be high because your kidney should be filtering out these waste products. But if they remain in your blood supply, it's usually an indication that there's something wrong with your kidneys. It's not doing its job. You guys with me? So your creatinine, your levels can be high, and if you look here, these are all different types of conditions with the kidneys. Glomerulonephritis, the glomerulus is the filtering anatomy inside your kidneys. It's what filters your blood and produces urine. So what it's saying here is you're having issues with your glomerulus. Glomerulonephritis, a swelling of kidney blood vessels. Pyelonephritis is an infection of your kidneys. Acute tubular necrosis. Do we know what necrosis is?
Death?
Yeah, dead. Okay, so part of the tubes in your kidneys are dead. Urinary tract obstruction. So if you have a blockage, reduced blood flow to the kidney from shock, dehydration, CHF, atherosclerosis, and also diabetes. Okay. All these can elevate creatinine levels. So when we do labs, we're going to do BUN and creatinine. We are going to read those data to assure that our patient is within normal range. If they are bordering on the upper range or they are excessive of that upper range, we can't give contrast media. All right? So these are the things that you have to determine and share with your doctor prior to the administration of iodine contrast media.
Do they get the clearance first from the doctor to get?
They do, yeah. So the question is, do they get the clearance first? Yes, they do. So prior to them coming in for an exam, okay, we should have the lab data in front of us. Okay. So go back to your clearance, they should have a clearance, but usually they just go to lab, nobody looks at it, and they come to our department. So we're responsible for also making sure that they're cleared. Okay? Because they're not always going to be cleared by the doctor. They've done the labs, okay, but the doctors are not always going to look at it. And then you got those that are stat cases where they're not outpatients, but they're inpatients. So the doctor will order, let's just say, an IVP, an intravenous pyelogram, it's to study the kidneys. They'll send our patient down like within 2 or 3 hours. They had the labs done 10 minutes ago. Okay? So we got to make sure that their BUN creatinine levels are within range. Okay? We also remember about keeping our patient in PO. If they ate within the last 8 hours, iodine can cause them to be nauseous and they can vomit, right? So if they ate within the last, say, 46 hours, can we do the procedure? Their labs are okay, but they ate. Can that be a contraindication? I'm just throwing some stuff out there for you guys. Is that a contraindication?
Yeah.
Yeah, it can be, because you've got substance in your stomach and you feel nauseous and you vomit. Now you may suck in or aspirate those contents into your lungs. Those are all things you got to think about when you're a tech. Now, all you thought was just this, boop, you're done. Nope, it doesn't work that way. You guys are clinicians. Part of what you do is, yes, you take images, but you also, there is nursing care involved in what you do. Okay? All right. Hemoglobins. Hemoglobins are found on where?
Red blood cells.
Red blood cells. The function of a hemoglobin is that it carries oxygen into your vital tissues and organs, and it carries any waste gas like carbon dioxide away from your tissues and organs. Okay? It carries gas. A good indication of your blood's ability to carry oxygen is by your hemoglobin count. If you're above normal levels, it indicates that you may be dehydrated. You may have an excess production of RBCs in the marrow and also severe lung disease. Below normal may indicate anemia, hemoglobin defects, cirrhosis, excessive bleeding, vitamin and mineral deficiencies, cancer of the bone marrow, and kidney disease and chronic illnesses. I don't have time to go over this. Okay? These are some causes of it. You guys will learn this in, did you guys already take disease? What's the name of that class? Survey of disease. Do you guys cover this? Some of this? Okay. All right, maybe lower during menstruation periods. Okay, your hemoglobin may be lower during menstrual periods. Doesn't affect us guys, only the women. You women are so lucky.
You eat the meat.
We eat the
And
meat.
we are the lucky ones?
Yeah, we're the lucky ones. Yeah, maybe lower during menstrual periods. Okay, think about this if you will. I'm not trying to be funny now. This is serious. When you're low in hemoglobin, what's the whole purpose of hemoglobin? It carries oxygen. What happens when you don't have oxygen going to your brain? Don't you become anxious and irritable? Yes? Women?
Yes.
Yes?
Yes.
Okay. I'm just stating a fact. That's all. So it causes anxiety and also causes irritability. Okay? Decreases slightly during normal pregnancy as well. Okay? Because now it's your unborn child that's utilizing more of your oxygen. Red blood count, or RBCs, the number of red blood cells in your body. If decreased more than 10% of normal value, then the patient is anemic. Anything less than 10% of normal value is considered anemic. Just like with hemoglobins, when you guys look at the ratio between high and low, they are similar into the causes of high and low. Okay? They're kind of 1 and 1. Okay. Normally decreases in pregnancy due to, again, to more fluids and and also living at high altitudes causes increase in RBC counts. Right. Athletes, you guys know about athletes? Where do they train?
High altitudes.
Higher altitudes. They train at higher altitudes because they're trying to condition their body. Okay, they're trying to condition their body to have more RBCs, more hemoglobin. So at a situation where you have high stress levels, high activity levels, your body is going to recover much faster. Okay, so living in high altitudes increases RBCs and should also increase hemoglobin, which carries oxygen.
It's a doping.
Huh?
It's a doping method.
It's a doping method?
Yeah.
Yeah. Platelets. Platelets. What do we know about platelets? What do they do? What's their function?
Clotting.
Okay, what?
Clotting, right?
Clotting. So if you bleed, this assists in the clotting method, the clotting cascade. Okay. Abnormal platelet, also known as thrombocyte counts or normally shaped platelets, are associated with bleeding disorders and other bone marrow diseases such as leukemia. We will do a platelet count. We will do a platelet count if there is unexplained bruising, okay? Or it takes a certain amount of time for the patient to stop bleeding. We'll do a platelet count. Autoimmune diseases such as lupus can cause destruction of platelets, as well as chemotherapy. Anything below, look here, 150 to 450. If you are below 20,000 microliters, you can have spontaneous bleeding. You can have spontaneous bleeding. Living in high altitudes also increase platelet levels. Remember, you're conditioning your body to be a warrior, living at high altitudes. Okay? So you can get beat up, you can breathe better. Your body recovers a lot faster when training in these high altitude conditions because it has those effects on hemoglobin, RBCs, and also platelets. All right, back to you women again. Okay, oral contraceptives. What does it say there that it may cause. What is the risk? What risk are we increasing when you're taking oral contraceptives? Blood clotting. Okay? With oral contraceptives, it increases your platelet count. Okay? So that's one of the side effects of oral contraceptives. All right. Any questions on labs? Okay, BUN, creatinine, RBCs, hemoglobin. What's the last one here? Platelets. Those are the labs that we evaluate. There's a few more that we evaluate, okay, in the department, but those are the basics. Again, you got to be knowledgeable of these lab data, know how to interpret them, and know how to apply them in your procedure. All right, let's talk about the patient's chart. Is there a lot of writing involved in our line of work?
Well, it's more computerized now, right?
It's more computer, okay? We may not be writing it, but we are still transcribing it, okay? There's a lot of data that is necessary in our work. One of them is charting. The whole purpose of charting, number one, is a smooth transition from one caregiver to the next. It maintains the line of communication to avoid any type of medical errors. Okay? So this helps in avoiding medical errors as well as minimizing the number of repeat examinations. Okay? It avoids duplicate exams. Okay, so that's number one. What we see here, number two. The information and the chart also provides information of medical research. It protects the healthcare worker in cases of litigation. The whole purpose of the chart, yes, is to make sure that there are no errors and there are no duplicate orders. But it's also protecting us in case there is litigation. You guys heard of CYA? Doesn't mean see you later. What's the CYA mean? Cover your assets. You're covering yourself. So we create a paper trail in case something happens. We can always go back and say, yeah, I did what I was supposed to do. It's charted right here. It's documented right here. You're covering yourself. Okay? Provide info concerning quality of care or institutional evaluation. So again, we're making sure that everything is done accordingly and within safety guidelines and standards. It also helps with reimbursement. So the hospital gets back what they put in. They get reimbursed for the different types of procedures that they provide. Okay, so what's found in the medical chart? Everything and anything, right? Your name, your address, your birth date, your social, your driver's license, your medical records number, your medical record number, okay? Religion, gender, where you were born, okay? All these things. And then we have everything from doctors and nurses and procedures that they've done, okay? So, physician's notes, patient progress notes, medications and treatments that they've received, nursing notes, even this. They keep track of who visits. All patient visits for outpatient ambulatory care. Laboratory and radiology reports. Medical history and physical exam. Admitting and discharge diagnosis. Results of exams, surgical reports, consent forms, education, okay? Education, we also do education. You guys know that? We also do education. When your patient comes into your department, you're not just taking an x-ray, you got to let them know what you're doing first. Okay? You got to let them know what you're doing first, because when you start touching them and manhandling them, they're gonna say, hey, you're abusing me. Or you've just committed battery and assault. Do you understand what I'm saying? So we do patient education. We let them know what we're gonna do, what to expect, how we're going to accomplish this. Okay? This is all part of patient education. We do it before the procedure, during the procedure, and after the procedure. All right? And again, all you guys thought was Hold your breath. Okay, breathe. That is a very small part of what we do. Very small part. Okay? Healthcare team planning, discharge, nursing care, discharge summaries, okay? So those are just a few things, and I'm talking just a few things. Whenever I get a patient's chart from the floor, if the patient was admitted and they're coming down for a procedure, their folder or their chart is this thick. You got to be able to sift through it and find all the pertinent information that you need to perform a procedure. Okay? You're also doing the preliminary sifting through the chart for the doctors. All right. But what is our responsibility as RTs? So we got the patient chart, but let's get more specific. Okay? Things that we're probably going to be writing on our portion of the chart. They're vital signs. Okay? Blood pressure, respiration, heart rate, right? Looking at labs, all those different things. Pregnancy and last known menstrual period. We need to know this. Okay? Why is that important for us to know? Because we're using what?
Radiation.
We're using x-rays, radiation for the procedure. So we got to make sure they're not pregnant. History of any allergies pertinent to iodine contrast media. What kind of allergies do you have? Are you allergic to foods or